Hello, I'm very glad to be among you today. Today is we present the second ASCO-GOIS International Webinars. Entitled today, the title of this webinar today is Notions and Needs for Global Oncology Implementing Science to Increase Affordability of Better Value Cancer Care, Global Cancer Care. This introductory overview, and I added here a note about also Optimus project. It is updated from a Global Health Catalyst Summit in June, John Hopkins. I am Ahmed Elzawawy. Ahmed Elzawawy, chair of Win-Win Initiative, chair of board of directors of Global Oncology University, the GOU, founder and president of ISODOC, International Campaign of Establishment and Development of Oncology Centers, past the president of Aortic African Organization for Research and Training in Cancer, professor of clinical oncology, Suez Canal University, and chairman of Al Suleiman Radiation and Clinical Oncology Center, Port Said, Egypt. And here is my email. Disclosure of conflict, none. But this presentation is on behalf of all leaders, faculty, and the Win-Win Initiative. And I inspire from the work and the discussion with distinguished colleagues, international organizations, and society in the world. Also, it is after personal discussion over years with leaders from health industry, major pharmaceuticals, and radiotherapy companies, Varian, Electa, for example. Particularly, I acknowledge the precious and very valuable advices over years till present of Mr. Dow Wilson, past the president of the CEO of Varian Medical Systems. But there is no any financial support of any kind. I am completely independent. Some brainstorming notes. What is global oncology? Reasons for this question is sometimes there is a confusion between science of global oncology, it is a science, global oncology, and the general public health topics, advocacy, and public talks about cancer. Even it becomes sometimes business, political talks, slogan. Although public health and cancer advocacy are mandatory and very important, but it's not necessary to be at all to be done by cancer expert and cancer research. It helps, but it is not necessary. The definition of oncology, according to Merriam-Webster, is a branch of medicine. It is a science concerned with the prevention, diagnosis, treatment, and study of cancer. It is science. Global, it means worldwide. So global oncology doesn't mean, as frequently thought, that it is a cancer of control of low middle income countries only, but it is global. Global means global, affluent and less affluent countries. Along this, the last 3 decades, and still, the gap between required care and cancer care and available was widened in the last 2 decades, and there is no convincing evidence that the needs wouldn't be increased in this 3rd decade of 21st century. This is despite of all conference, festival, reports, commissions, summits, but unfortunately, this is a fact. Recent report in 2024 indicates that there will be 77% increase in incidence of cancer in the upcoming 25 years, with tidal wave among ages younger than the previous decades. So we should be prepared. Is the cancer of problem of the last few centuries that sometimes some claim that cancer is related to divisions, proliferation, and mutations of cells, and started with the first multicellular creatures millions of years before first mammals. Yes, there are some now factor increase some of its incidence, like climate, tobacco, chemicals, etc. For the question of finishing cancer tomorrow, to be zero in the world, including low middle income countries, we state that to be scientific, fortunately, cure, survival, quality of life are improving remarkably. cancer area diagnosis, detection, and prevention are increased. So every collaboration and effort should be paid for that and not for slogans. The problem is in the affluent countries too. Is not only in low middle income countries with different degrees and variations. According to the American Society of Clinical Oncology, 40% of American citizens, the first cause of fear of cancer is its financial burden and the risk of bankruptcy. In ESTRO, European Society of Radiation Oncology, this is in Europe, 1/4 of cancer patients in Europe didn't get the indicated radiotherapy. You imagine this. In a recent report, an Medscape article, it is stated that the median launch price for 13 new cancer drugs introduced this year was $257,000, which is more than 3 times the median household income for a Californian family. Shall we in the world continue in the same previous approaches? There are very constructive initiatives, but each initiative focus on a needed part of the global challenge. For example, Choose Wisely, the American Board of Internal Medicine led the Choosing Wisely campaign. More than it shows that a list of more 550 examples of unnecessary and low-value services. Common Sense Oncology, an important initiative. Dr. Bishal Giwali will present today also a wonderful presentation about Common Sense Oncology. He is a co-director of, co-founder of Common Sense Oncology with Chris Booth, Richard Sullivan, et al. It's focused on using what could be obtained and implemented in different parts of the world and addressing disparities in funding clinical trials. Several initiatives by important organizations, society, WHO, IAA, individual experts, like calling to focus on essential cancer drugs or generics, drugs or resources, stratified guidelines, or less complicated technology in radiotherapy. Achieving universal health coverage is one of the targets for 2030, 13 Sustainable Development of United Nations. However, we see that it is obvious the skyrocketing increase of cost of cancer care and new drugs that don't commensurate with the increase of curve of improving outcome is a big barrier to achieve such goals of the universal coverage, universal health coverage. So it should be we should be have attention for this. As a realistic example is a huge big obstacle. Is the waste of the huge big obstacle is the waste on healthcare. For example, the estimated waste in 2024 in USA health system ranged from $760 billion to $935 billion. It's around 25% of the total health spending. And we speak about resources and funds and the win-win movement introduced by Ahmed Elzawawy, by me, modestly, in December 2007, after inspiring and consultation with many experts and stakeholders in the world. I didn't invent anything. I based on many evidence and scientific evidence and publication by many. Aims at the increase of affordability of better value cancer care for millions of underserved cancer patients in the world, in rich countries and in low middle income countries via scientific approaches and within win-win scenario. It is not competing or replacing any, but it is a forum for all. It belongs to and owned by all and owned by all. We don't claim any invention. It is based and inspired from scientific work of many scientists and authors. We don't seek for any glory, but the glory is for the real doers everywhere. The win-win is a new notion. and not a competing body. So it could be adapted and adopted by any. The win-win is a message of love, but not in words, in words like I love you, or slogans, but it is expressed in scientific exploration, collaboration to serve the cause of affordability of better value cancer care with dignity for all, regardless their nationality, beliefs, or color. Why win-win in the real world? It should not be satisfied with not less than patient-centered value cancer care for the majority of population in the world. The interests and incentives for all stakeholders should be considered to be in the real world. To be realistic, incentives and remuneration of professional cancer care are mandatory, should be considered and repaired. Otherwise, the different ways of corruption under different names or abuse resources in different parts of the world will continue. But it needs smart and innovative scientific focus approaches and broad scope intelligent deals. Even the industries will flourish more and enormously increase their markets. There is a need to change the present game, and for a think tank like that proposed by President Franklin D. Roosevelt for the New Deal. The two wings of the win-win international scientific initiative are to increase affordability of better value cancer care via scientific approaches, exploration, education, studies, and win-win model. Two, to increase the number of quality of care service in the world via catalyst action. We don't pretend or claim that we do all. Via catalyst action, relevant education and training. It is a great need for wide education and training programs focused on the goal on how to enhance the human capacities and resources that adopt and lead scientific movement to increase affordability of triple value cancer care, the patient, the community, and science. For millions of cancer patients with dignity, as soon as not just the usual ready-made programs or stereotype repeated curricula, or to repeat the same thing, there are many. Global Oncology-Implementing Science program, created, is a part of Global Oncology University, is an example of collaborative model that could contribute in serving this defined goal in the world with all of you. In the win-win initiative, the Global Oncology Implementing Science virtual program, some of the notion is important notion is that we advocate for brainstorming and stimulating global collaboration for exploration of unlimited number of scientific approaches and studies. We present and openly discuss tens of published scientific examples in different fields of cancer care. Also, we present a real-world example of success, collaboration, and initiatives to provide approaches to expand number and value of offered cancer care, and the win-win modified blue ocean strategy that entails enormous increase of opportunities to expand services via global win-win models of coordination and cooperation. Once again, all will gain. In the next webinar, we'll explain many of these things and in the course before. Some of the important notion of the other important notion of the win-win initiative is no rivalries. All initiatives and players are needed. The problem is not in the players, but in the game. Classic and innovative scientific approaches, brainstorming, flexibilities of thoughts, and free flows of idea. The interest and incentive of all stakeholders are considered. All win-win. With smart approaches, the present winners will gain more, and the present loser will have opportunity to obtain their need with dignity. Question 1 to all: what is the global value of new treatments and more cost if it is not affordable for the majority of cancer patients in the world? What's the value? 2, what is the value What is the global value of awareness, screening, and early detection if the patient have no access to affordable and nearby care with dignity? I leave the answer to all of you. It is waste of time to think what is more important. It's but it should be a global balanced approach. The GOIU starting in 2017 and there is a link for Global Oncology University, prioritization for all. Implementing science seeks to continue the job. Biomedical research or discovery or study or trials, whatever scientific importance and value, would not be complete except with the scientific study for its use and in practice. And we stress on scientific studies on how to be accessible and affordable in the real world. Global Cancer Fund, is that will be the solution? It helps, but it is not the magic soul big solution. Whatever the amount of global and local levels, the richness of a country, then if we don't adopt scientifically value-based care and approaches that include reducing the waste, then it will be like trying to fill a tank while there are many big holes at the bottom. We cited many examples of how to reduce the cost, and this will be in the next webinar and be in the courses before, and we have in our books, and there will be more details in the next sessions. For example, how to reduce the cost of 100,000 or more per patient for certain cancer drug in USA. It's possible. Professor David Kerr will present this in more details, and I'll present it, and our distinguished colleagues too. For some other example, it's scientifically possible to reduce the cost of scientific waste by 70 to 80% without compromising the outcome on patient. Please see examples of reference below. We stressed on what we published by many authors, the need of revisiting and the reassessment of doses of all new drugs, particularly targeted and immunotherapy of cancer and clinical trials. Doses could be more optimized on scientific basis. The high cost will be reduced and avoid unnecessary toxicity, all without compromising the outcome, and even to get better value, better outcome on patient health. After many publication, presentation, and pleas by many experts, now we have great news. This is Project Optimus. It is by the Oncology Center of Excellence, FDA. It is for reforming the dose optimization and dose selection paradigm in oncology. The goal is to educate, innovate, collaborate, and with companies, with academia, with professional society, with the international regulatory authority and patient to move forward with a dose finding and dose optimization paradigm across oncology. Some example, to cite one example of the West, it's a shocking example of the West. There are many, but I sit here just for example. You will have in the other webinars after. The waste of leftover in vial for some expensive cancer drug in USA is estimated to be $3 billion per year. And we speak about the resources. Are there solutions to reduce enormously this waste of $3 billion on the leftover? Yes, it is published. But who listen? It is possible to treat double or even triple the number of patients with the existing present facilities of radiotherapy in many countries. Yes. Many authors and we presented different approaches for how to do. For the last point, to be in the real world, will that decrease the upcoming plans and expansion and sales of manufacturers of radiotherapy device? No, It will be the most important, operational way to show how radiotherapy is cost-effective. Hence, with smart approaches to open weak or dead, even dead market for the needed new, at least 10,000 radiotherapy and clinical oncology service. Question for all organizations, institute, different philanthropic initiative and government. If you have a sum of money or fund you spend on purchasing some medicine for some stratified resources care in order to offer to fraction of underserved patients as a way to increase access, or it will be of more value if you spend this sum or part of it on scientific and smart approaches to increase affordability of better value cancer care with dignity for millions of underserved patients in the world. All will win. I leave the answer for you, to all of you. In the upcoming third and fourth and fifth ASCO International Webinar, we'll tackle many published examples and approaches, how to, via scientific approaches, to lower the total cost of systemic cancer therapy. And also we have 4 webinars concentrated and focused on how to increase access and affordability of radiation oncology and prospect of molecular radiotherapy. It is a miss to consider many lower middle income cancer in Africa of limited resources. Most of limited low middle income countries have the curse of having rich resources. Is the solution to send some funds or begging or charity from rich countries to Africa or other low middle income countries? No, no, no. Should be well scientifically planned, transparent, win-win approaches. Every US dollar should have its positive return on both taxpayer in rich countries and citizens in low middle income countries, and scientific progress as well. No one should lose. All stakeholders should win. The present winner will gain more and not less. The present underserved will get their requirement with dignity in the real world. But if you continue as we are, the crisis will increase for all. Isn't the time to be a game changer together as organization, independent, coordinated efforts, all stakeholders, institute, and all within a global win-win smart campaign based on scientific realizable approaches? I leave the answer to all of you. Finally, the only hope for success of this scientific initiative is to be adopted, improved, implemented, and led by many. The question, how to do we have a chance to succeed? Yes, if adopted by all and everyone study how to increase the chance from his side with every institute, every all partners. The win-win international scientific initiative belongs to all and surely to all of you. The message is for all stakeholders. It is also for all the younger generation, and we ask them to advocate and to raise the flag for better near future. Thank you. A warmest welcome to all. This is my email and website. Please, we welcome all your feedback and contribution. Thank you all. Thank you all. We are waiting your feedback and contribution. And bye-bye.